already, and I know there are more that will be hopping on. But first of all, thank you all for joining us at Grow Cedar Valley. It was the beginning of the week, and Mayor Hart said, you know, Carrie, I think we still need to have another town hall meeting and get the latest from our healthcare professionals. Obviously, things are changing minute by minute, not even day by day, but minute by minute. So this is where we hope to get the most current information, knowing full well that it may change again. So I'd like to welcome with us today Dr. Nafissa Egbuonye, the Director for the Blackhawk County Health Department, Pam Delagardelle, CEO for UnityPoint Waterloo, and Jack Dusenbery, CEO for MercyOne Waterloo. So we couldn't have been able to bring together a more professional group to share information with us today. And as I've said to all of them, this is about conversation. This isn't about presentations. It's about what can we share with our business leaders, our community leaders, about what we need to know in the Cedar Valley about what's going on with the healthcare situation. So everybody knows the numbers have spiked. Education and business are trying to, in good faith, accommodate and make sure that everyone's safe. Not only in our case, employees, but patrons, as well as healthcare providers and frontline employees. So Nafissa, I think I'll have you go first. As we hopped on, she said she had talking points from last night and then they changed already this morning. So again, I'll just ask those of you that are joining us today to please turn off your microphones. Some of you can turn off your videos also. That way the guests will be those that will be on the screen, but we'll have room for comments and questions in the chat box. So go ahead and fire away. But Nafissa, I'll turn it over to you first, please.
Well, good morning. Good morning, everybody. And thank you for joining us. This has been a long journey. I mean, 2020 has been such a difficult year for us. And unfortunately, it's been a year that has been complicated by so many things. And what I can say that's human behavior, right? So that's one of the basic things that we learn in public health first is about human behavior and behavior change. And so my ask to you all first is just know that our healthcare system, our education sector, even you all in the business community, we do know that you are doing your very, very best. Public health is here for you all, and we really truly enjoy talking to the different leaders within the different communities and just reviewing the guidance and updating them. I had talking points prepared, and I have my 2 staff members who are brilliant people on this call, Jared Parmeter and Josh Pecora, and they said, oh, things have changed, since last night. And so I won't go in details over that, but do know there's a press release that is, we will release with the updated guidance. There's probably a lot of questions in regards to recreational and group activities, gyms, and whatnot. And so we will push that communication to you all. And please do know anytime you have questions or you need clarity on the guidance, public health is here for you. And that's what we do. That's what we do. So we will support you all in implementing those measures. Blackhawk County, it's been very difficult these past few weeks. Here at the department, with the number of cases that we have been experiencing, I have to be very honest. We are backlogged in our disease investigation and contact tracing, but that is not an anomaly to other counties with our size. We're seeing it with Lynn County, we're seeing it with Johnson County, and we're even seeing it at the state level. I am in constant communication with the state colleagues and the governor's office. I've expressed my concerns and frustration in regards to the guidance. When those changes are constantly changing, it's really important that public health takes a look at this first. before those changes start occurring at the state level, because everything that we do has an impact here locally. And so they have taken that into consideration. And so they did let me know they'll get back to me when in terms of how to change the structure of these guidance. I'm also in constant communication with our interim director, Kelly Garcia. So do know that, do know that I'm always engaged with the state colleagues and trying to do what's best here for Black Hawk County. We are engaged with our healthcare providers, UnityPoint, MercyOne. We have now bi-weekly meetings with our medical directors, just to get updates on what's going on within the hospital system, and what we can do collaboratively together. So we're having talks also about vaccine planning and allocation, and whatnot. So that's happening. Oh, I'm so sorry. So that's happening. In addition to that, with our backlog for contact tracing and disease investigation, we've had to prioritize groups, and we do it based on data. So we are prioritizing K through 12. We are prioritizing people 19 to 24 years of age, individuals over 60, with, perhaps that might be more at risk of disease with COVID. Employees that are working in industries that social distancing is very difficult, such as Tyson. So we're looking at that and we're prioritizing. We're also coordinating with the state. They have stated that they can help us in terms of disease investigation and contact tracing. So we are doing the most recent cases. We've had difficulties reaching people. We've had, we've communicated through different outlets, like, for people to answer the call when they receive a call from the health department, but we have had difficulty reaching people. So what we do is we call people, we text people, and then now we're sending out letters, but we're gonna do some more creative things to see how we can get a hold of people. But when we do notice that their isolation or quarantine they've gone further in, and they're less infectious, we're not prioritizing those groups. So we are prioritizing the newly infected cases. So with that, we are also looking at, let's see, again, vaccine planning. You've heard the good news. There's light at the end of the tunnel. Moderna and Pfizer. Pfizer, I believe yesterday stated they're 95% effective, and Moderna at 94. So that is good. There is light at the end of the tunnel. However, we still need people to practice those safety measures, the preventative measures of masking, social distancing, washing frequently their hands. And that's because, when vaccines are released, it's not gonna be for the general public, so they're gonna prioritize key groups such as the healthcare system, which needs it greatly. And I believe Pam and Jack will tell you why it's important for them to get the vaccines first. And then we'll look at critical populations, those that have been really impacted by COVID-19. So one of our responsibility is actually to engage the key community leaders within those populations to help us really promote the vaccine. So internally, I can guarantee you that we will do our research to understand all the safety measures behind the vaccine, because I'm hearing a lot of uncertainty about whether people will take the vaccine or not. So we will do our part. Black Hawk County Public Health, if we question something before we communicate to the public, we seek for clarity first. And so that I can promise you, we will make sure that we understand the process. We have to be comfortable and confident about it, and then we will communicate with you all. But we are going to need community leaders that are going to help us to really educate the public as well, so that the public understands the criticalness of getting vaccinated. So you will be hearing from me at different times throughout this year. So with that, also, like I said, let's see, I think I've covered most of it. Just in terms of our data, and our data is on Blackhawk County COVID-19.com. Again, we are seeing more of the 19 to 24 years of age and populations that are predominantly affected. There is some stability within our positivity rate, but it's still, I don't want to say in such a way that people are, taking their guards down. We still need to do our part. Like, this is not over yet. We really do need to do our part to continue with our masking and social distancing and washing of our hands. We are seeing that zip codes 50613, 50701, and 50702 and 50703 are impacted. But that's not to say that, it's really, it is community spread throughout Blackhawk County. The way we navigate our communities, we are together most of the time. And so I don't want people to think that it's just always in one particular area. There is wide community spread, and we are seeing it. It's really among the different households intermingling, people having smaller group events, and right now with the governor's proclamation, you will see why. And that's data that is being communicated at the state level with all the other counties that are alike. So that's why she is limiting the indoor and the outdoor as well. So I leave you all with this, and as questions come, we will answer. Be hopeful. Be very hopeful. I do believe that there is light at the end of the tunnel. However, we all need to do our part. And Pam and Jack, you will explain, I believe, to the group why that's important. Our healthcare systems do need you to continue to do your part. In terms of employees, if employees get tested for positive COVID, we do need you to be flexible with their leave. And also some of the guidance in regards to return to work. We don't want people that are still infectious coming back to work. We want them to stay at home, be healthy, call their healthcare providers, and the healthcare providers will do the assessment. We're getting a lot of feedback where people are trying to self-diagnose, or the business is communicating something else to them. Let the healthcare providers do their job. That is what the medical directors have asked of us. And so I am communicating that to you all. We work very close with our providers. And so I trust in what they're doing. And so if you have any questions, also always call the health department. We are here for you all. So thank you, and let's continue to mask and social distance.
Thank you, Nafissa. And we do have questions coming in, and they're going to everyone. So thank you to your staff that are answering some of those questions about testing and that kind of thing. So please thank them for us. Let's move on. So we obviously, Nafissa, or Dr. Egbuonye, you did a great job about where we are, what we still need to do. There's a huge impact on the healthcare community already, and will be for a while. So I'd like to hear from Pam and Jack about not only where we are, what you're facing, but what we need to know, what we can do. So Pam, I'll let you go ahead and go first, please.
Carrie, and thank you for the invite today. Our healthcare system is at capacity at this point in the local area, over capacity at UnityPoint Health. I have a clinical background, and so these are the things I'm really feeling confident about. There is more science around the care of our COVID patients than ever before. We have really perfected the standard of care. Our patient protocols are on point. We have great drugs now that are helping us care for our patients. You are all have heard of remdesivir, dexamethasone. but now we have a new monoclonal antibody that we began infusing 2 days ago, bamlanivimab. And so we are offering that now as well, which we think will keep people out of the hospital. What I want to share with people today is, this is kind of a third surge for us, or a third wave. And this surge is very, very different for our organization. We know that the virus hasn't changed, but the scale of the community spread is dramatically worse this time. And so, we have more COVID cases per capita in our state other than North Dakota and South Dakota, and we can do everything right in terms of the way we care for patients in our hospitals and clinics, but we cannot control the viral spread in the community by ourselves. And so I'm here today really on behalf of our team to ask you to help us with that. This spread is occurring mostly outside of our walls, but it comes to us as people are sick. And during our first 2 waves, our COVID surge numbers, so when we talked about we surged up, those numbers were right at 30 patients at Allen Hospital. During this week, Allen Hospital has seen 80 COVID inpatients at a time, and we have another 100 acutely ill patients with other issues. So while we have more resources, tools, and protocols to help our COVID patients than we did back in March and April during the first 2 waves and in July and August, but our COVID patients now have a much longer length of stay than any of our other med-surg patients. So we're caring for more patients who are sicker and staying longer than any time in our recent memory. During the first wave, we closed everything down due to the lack of personal protective equipment, and we were able to redeploy a ton of staff. Today, what we're seeing is a backlog of really sick patients. Our clinics are surging too. They're filled with really ill patients, in addition to the COVID patients. So just this past week, our 4 UnityPoint Clinic Express sites cared for over more than 500 patients a day, which is more than double what their COVID volume and their patient load has been. Our clinic staff was able to be redeployed to the hospital last spring and summer, but they're doing their best to keep people out of the emergency department and care for our outpatients. In those first 2 waves, we had very few hospital team members who had developed COVID, but now because of the community spread, today we have 102 people that are recuperating from the virus at home. And you all know how many days that they have to be away. So this cuts even further into the number of people that we have available for reassignment right now. And we know that safety is always our priority. So we're not going to return people to work until it's safe for them, safe for us and our patients. So what I want to share today is, we have plenty of beds that we can pull into the hospital. This is not a bed issue for us. It is a staffing and capacity issue. We have over 200 travelers that are helping us. And so, we're in a situation now, and I'm going to be really careful about communicating this, but, we're in a situation where critically ill people are getting hung up in our ED or needing to be transferred to other places because we do not have the ICU beds available or the patients or the staff to care for them. We've on many days been boarding patients, so have inpatients in our ED and 30 people in the waiting room. And so, my ask of all of you today is really to follow the guidance, to be safe. We really need you to ask your employees and friends, to follow the guidance. We need the business community to do, more than ever to do their part. Need you to care for my work family so that my work family can turn around and take care of your family at this time. And that's really the comments that I wanted to make today, Carrie.
Thank you, Pam. Good updates. And once again, thanks to Jared and Nafissa, your staff, for answering questions in the chat. There's several on testing and the kinds of things that as employers that need to be considered with quarantine and that kind of thing. So thank you, and ask them to keep answering those questions. That's great. So Jack, I know you're on the phone, but I know you're with us from MercyOne, Jack Dusenbery. I'm sure you're seeing similar numbers as what Pam just shared about with UnityPoint. How are you handling this? Probably not much differently, but what do we need to know? How can we help as business leaders and community leaders?
Yeah, thanks, Carrie, and thanks, Nafissa and Pam. I'll make a few comments. I hope you find it, interesting. So, last night, the last email I dealt with at Waterloo Medical Center was a local business wanting to bring Panera into our ICU for the staff. The generosity of the community has just been outstanding from day one. It seems like years ago, but last spring, like Pam said, we were talking about PPE and is hydrochloroquine effective or not? And we've advanced so much, and the support has always been there. Our numbers, MercyOne statewide, we have more COVID patients today than the entire state of Iowa did when the surge occurred last spring. So we're all, very, very busy with the COVID, as Pam described. And like all other hospitals, many of our staff get COVID. And that puts we're strained anyway. And then that makes it difficult. So staff is definitely a limiting factor. We have beds. We're not turning away patients. But there is a finite number. Pam referenced the ICU beds. We use other parts of our hospital and we're creative to create ICU beds. Our worst case scenario would be to close surgery again and have to use our operating rooms as ICU. And I don't like the word elective surgery. I don't think it's fair. If you tell somebody who's been waiting 6, 7, 8 months with a painful hip or knee, another difficult part of their body, to them it's not elective. They need that surgery. We're here. We want to take care of people. I would say that, we're in the national news today. I saw it this morning. I saw it last night. That's not a good thing. The outbreak, I like to tell stories. And a story that I tell our staff, and I'll equate it back to COVID, it happened in a non-Iowa hospital several years ago. But 2 people were in a semi-private room, and the staff was in and out taking care of both of them. And one wanted to be by the window, and the other patient did not care, and they switched beds. And we teach our staff 100% of the time, it's a red rule. Every time you have to check the patient identification. Well, in this scenario, some care was rendered. It involved a blood product, and somebody lost their life because they didn't check the identification. And the patients probably assumed the staff were in and out, and they knew who they were. And, just the odds of that, I'm not sure what they are. One, and you probably couldn't even calculate it. It may never, ever happen again. But Terry, if you were a patient and I was your nurse, even though I know you, I would check your identification every time. I would never break that rule. Well, here's how I'm going to equate it back to COVID. Family gatherings coming up, large, fun social events. I would challenge everybody and help others understand, don't be the one. It'd be horrible if grandma or grandpa or somebody got sick and it ruined a holiday, and Lord forbid they're in our hospital, and there are people who do lose their life. We've had deaths in Blackhawk County. It's a very real thing. You just don't want to be the one. Nafissa referenced vaccines. I'm optimistic too. I think better days are ahead, but I've canceled Thanksgiving with my family. My mother, that's hard. She looks forward to that. So cancel, postpone, be smart, set the right example. I just go back, don't be the one. A few other comments I would make is just in terms of, back to our hospitals, we kind of try to tell people, let's say that Blackhawk County, approximately 131,000 people, and we've wiped out COVID. This is such a tricky thing that one visitor could come into our community and start the spread again. So you just back to the masking, the hand washing, the things that we've heard about for months. You just can't overemphasize the importance. And Lord knows, maybe none of us are perfect. And I know I haven't been, but I have been wearing a mask since March. I'll just a few other comments I'll make on a different topic, telehealth. I remember speaking to a forum this past spring, and I was very hopeful that telehealth would be here to stay, and a positive out of this horrible pandemic has been the use of that technology. I can tell you, other than behavioral health, we were pretty much non-existent in that arena of healthcare. And now today we're breaking the 300 a day barrier. And I really think those numbers will increase, and that'll be a positive, here to stay. The use of technologies and not making people come into a waiting room and wait for their physician or their provider. So that I would offer as a good thing. And maybe with that, I'll just, one other comment I was going to make. You know, we test people if they're going to have a surgery, if they are admitted. We want people to be tested prior to those that particular care being rendered. I will tell you, lately, 1 to 3 people a day without symptoms come to our facilities thinking they're going to have a procedure and they test positive. So, you know, that's the other difficulty of this. There are a lot of asymptomatic people. I'll tell a personal story. I kept my son safe when he came back from the University of Iowa last April, my son and daughter, got him through the summer. I tease him and I tell him he went back to Iowa in August, and it took about 10 minutes and he was positive COVID. Now, he's a young guy and he did fine with it, did the right things, but you know, it can happen so fast, and that test is only as good as the day you have the test. I'm just going to ramble 2 other comments in my mind. A lot of confusion about wearing the mask. I still have friends who think, you know, this mask isn't N95. I'm not fitted. Does it really protect me? And they miss the point that if they wear a mask, they protect others. If I'm wearing a mask and I'm speaking, I'm protecting other people, you know, in a room with me, and hopefully more than 6 foot apart. So I still think we haven't done a really good job explaining to some people the importance of that mask. And like Pam said, we need everybody to be responsible. I just don't understand people that won't wear a mask, you know, at least to help us get through this time. And again, on an optimistic note, at least the past 2 weeks as we surged up, I've seen our numbers this morning. We're stable at least. You know, I was hoping it wouldn't be, you know, another X number of admissions, and we keep growing. So it looks like, you know, right now, at least for the last 2 or 3 days, we've stabilized things. And then I'm optimistic, hopefully that curve starts going back down. Thank you.
And Jack, sure, thanks, Jack. And the one thing you touched on was, as you identified with your son, was asymptomatic. He didn't even know he was positive, and that therein lies the real reason masks should be worn, because many people don't even realize they may be COVID positive and may never know that, but the mask is still very necessary for those who don't have symptoms and don't know that they're positive, you know, every single day, every minute of every day. So we have lots of questions. Most of them are being answered. Thank you, Nafissa, again, for having your staff answer those. One thing I do want to mention, we have maxed out our Zoom account, so we weren't able to let everyone in, but we are recording this as we do all of our town hall meetings. It will be posted, and we're happy to send this to anyone to share with their employees or anyone else who tried to get on to listen and weren't able to. They'll hear all the same information other than not being able to file questions. We did talk a little bit about the vaccines, and thank you, Nafissa, for touching on that. And I think you're right. I mean, I know you're right in that it's right now it's education leading up to when those are able to be distributed, and making sure people realize that, at least from the perspective of Blackhawk County Health Department, they will not be distributed unless they're safe, and safe through the data that you and the other health departments have researched. Is there anything else that needs to be shared about either the vaccines or leading up to them? I know that everyone's waiting for those. It's what I understand, it's going to be phased based on the different levels of not necessarily need, but necessary for our healthcare workers and frontline employees and care providers. but the general public would think to be able to access those vaccines, and would it be through the hospitals, through their doctor's offices, through
Yes,
the
for
health
the general,
department?
yes, for the general public, it will most likely be through their providers. And so, as I stated earlier, the way the vaccine, it's going to come from the federal partners and then through IDPH and here to us at the local level. And so vaccines will also be reallocated to the hospitals and to be able to administer the vaccines. So it will be through the providers. You will just see there's different phases, phase 1, phase 2, and phase 3. In phase 2, we will start to get a little bit of the general population, but again, it's also looking at the critical populations that will need it. So when you're healthy, you might not actually get the vaccine until maybe in phase 3. So, and those are things that we will communicate the moment that we get clearance in terms of the vaccine. We will do that communication to the general public so they understand. I just don't want people to go into panic or believing that a vaccine is out there, but they can't get it. And it's just that we have to also prioritize how that's going to be administered. And with that, that's why it's still important to continue to mask, to continue to social distancing. And so there shouldn't be any assumptions that because there's a vaccine, our preventative measures should stop. No, we will still continue, but I just, I'm encouraged by hearing the personal stories, because I think so much of just people are COVID fatigued. There's just so much data, so much guidance, so much, the polarization of COVID really is here. And so I think for us here in Black Hawk County, my ask as a health director is to, understand that nothing really can be accomplished if we don't do this collectively. We all have to be in this together. And so we just need to continue to do the best that we can for our communities. And our staff, I see Dr. Lindeman is here joining us too. But I'll tell you, for example, with the schools, we have biweekly meetings with the superintendents. We're fully engaged with what's going on in Black Hawk County schools. And for them at their end, it's like staffing shortage as well, But we want our kids to be able to go to school and to be able to do it in a very safe matter. But we also understand the domino effect of virtual learning, right? What are parents that are in public health or in the healthcare system going to do if that happens, right? So this is why we need everybody to play their part, especially as we go into the holiday season of Thanksgiving and also Christmas. Think about it as we are doing the right thing. That is our way of showing gratitude and respect for our community and for our loved ones, right? And so I'm just very encouraged to see the number of people also that are here today with us. But yeah, so with the vaccine, once we really get more information, as the news is also sharing, so we're hearing at the same time, we will definitely start that education piece the moment we get clearance. We will do that. But behind the scenes, it's planning in terms of distribution, in terms of storage capacity, and also the critical populations.
Thank you. And you referenced education, and I know I've been in touch with the superintendents too, and they base their current decisions on the data that they get from you,
Yes.
from Black Hawk County Health Department. And I know that the decision to extend the Thanksgiving holiday based on knowing what the incubation period is in case people do gather and get together, that this is in large part, and actually in total part, so that the kids can go back to school in December.
Yes.
This is a preventative measure that's being taken from the schools and school systems in order to assure or reassure that the kids can get back to school in December, assuming everybody does their part, as you said.
Yeah, and Carrie, we've learned here in public health, the mental health of the students, even the elderly population, that isolation, students really they enjoy being with each other. I have a little boy, and he's the one telling me how to wear my mask, and so they enjoy being together. That is also part of their development. And so when you have children that are also isolated, you have to think about, the domino effects of that, and children that have come from two-parent household that are working, or one-parent household. What are they going to do? What is going to be, the domino effect of that? And so we have to take things, as I say, in a systems approach. It's not just doing things in a feel good approach. We have to really think about the overall system and how it can have an impact on us.
Good. So I'll open it up to all three of you if there's anything you want to share based on the conversation, anything come up that you want to either reiterate or reinforce, or anything new that you'd like to share with the group. And I'd also like to mention that, as I said, that this is being recorded, this will be posted, and you're welcome to reach out to Betty on our staff, Betty at Grow Cedar Valley, to receive a recording. We're happy to share this with anyone because this is vital information that needs to be shared. But I'll open it up to you, Pam and Jack, too. Is there anything else you want to share with the group before we hop off?
I'm happy to take any questions. I think, really covered the points that I wanted to. I do want to join Jack in really thanking our community, our local employers, people from the local churches. The support to our team has been amazing. Our team, understandably, they're ragged right now. They have gone without any vacation days, on their day off. We're calling them in to ask them to pick up an additional 12-hour shift. It is all hands on deck here. Every secretary, every back office person is either rolling gowns or sitting with patients. Everybody is engaged in the care of this community right now in this building. And so I want to thank everyone for doing your part, and turn it over to Jack for any comments.
I'll just add one other theme. One of the difficulties of this has been visitors, and all hospitals throughout the United States have wrestled with this. I've learned to not like the word visitor. We're trying our best. I like the word support person. So I can tell you today, I think it's very important, and especially with the high census and staff out and the needs we've just described, that a loved one often needs to be in the room and helping somebody make sure, they're getting dressed appropriately and helping out. So I'll just let the community know we're working hard to try to use common sense and try to get support loved ones, support people. And I'm not talking about families and more than one person and you have to wear a mask, but we are sensitive and we are compassionate healthcare institutions. So that's another thing. I think healthcare, we're getting better. Hang in there with us. And we're going to continue to work hard to make sure loved ones can be with their appropriate other loved ones. And I'll just end saying thank you for all the support we've had throughout this whole process.
And Pam, you said you take questions. If anybody wants to throw a question in the chat box, go ahead if it's specific to any one of these, or I know these three professionals will entertain any questions that you reach out to them personally with. So I see lots of thanks going on. And, thank you just doesn't seem like enough to the three of you and your teams, because we know, and I have a daughter that's a nurse and she's working 16-hour days and has 5 kids. And I know how hard all of your teams are working. And I guess, again, thank you just isn't enough. But without knowing what other item to bring up, I'd be happy to entertain any questions. But thank you, Dr. Egbuonye and Pam and Jack. We know we couldn't be the community we are without you as leaders, and we as Grow Cedar Valley are here to help connect you with any of the resources through this Business Leader Consortium that we can to help you. So please don't hesitate. Anything else?
Thank you for the invite today, Carrie.
Sure. Absolutely.
Thank you, everybody. And we will get through this, we will get through this, remain vigilant, remain hopeful. But thank you so much for your support. And the health department is here for you all every step of the way. We will get through this.
And we'll be getting together again in a town hall meeting, I'm sure, with the three of you. And I'm hoping that it's when numbers are and information and data is more positive. Let's hope that this is the bottom of where we are with as far as what the data and the numbers are saying about the Cedar Valley. But until then, you're right, we will all be working together, and everybody stay safe. And happy Thanksgiving.
Thank you.